everyone, and welcome. My name is Charlotte Morgan-Faller, and I'm an Associate Director for Programs and Investments at the Power of Nutrition. This year marks the Power of Nutrition's 10-year anniversary, and to mark the occasion, we've launched an Impact and Learning series where we're looking at successes, challenges, and lessons learned from 10 years of finance, programming, and partnerships. As part of this process, we're launching an impact report, as well as a number of academic papers and technical reports, and we're also holding a series of conversations with our trusted partners, for example, UNICEF, who are on the call with us today. We're absolutely delighted to be here, to be having a conversation about multisectoral programming approaches. But before we jump in, I'd like to hand over to my esteemed colleague and partner, Raji from UNICEF. Raji, would you like to introduce yourself?
Thank you, Charlotte, and the entire team. It's a great privilege to be part of this journey and the partnership. I'm Raji Nair, nutrition specialist with UNICEF Maharashtra, India.
Thank you, Raji. So we're delighted, as I said, to be joined by Raji from UNICEF. UNICEF have been a long-standing partner of the Power of Nutrition. In fact, ever since the Power of Nutrition was launched, UNICEF was one of our founding implementing partners. So we're delighted to be together with UNICEF today. And the topic for our conversation today is looking at multisectoral programming approaches. So what do we mean by multisectoral approaches? Well, we know at the Power of Nutrition and at UNICEF, we know that all forms of malnutrition have multifaceted drivers, and it takes interventions across multiple sectors, whether it be health, nutrition, social protection, education, early childhood development, water, sanitation and hygiene, food systems, the list goes on. So it takes a number of interventions across multiple sectors to impact those multisectoral drivers of malnutrition. So today we're delighted to be talking about one of our great examples of a multisectoral programming approach in Maharashtra. So Raji, would you be so kind as to share an overview of our program in Maharashtra, our partnership together? How is this an example of a multisectoral approach that really responds to the holistic needs of the child?
I think it's very important to also bring to this audience that multi-sector was also a joint partnership of developing and co-designing the proposal with Power of Nutrition. Very rarely we have proposals where you sit and develop it with the donors. For us, Power of Nutrition is not just a donor, but it's a partner that added value to the work UNICEF is committed to. Having said that, for us, for UNICEF, child is the center to our programming because child is vulnerable and child families have aspiration for children. The journey of partnership began way back in 2019 when we co-designed the entire proposal. And in 2020, we really started the implementation. How did we really begin the programming was one, we really looked, that was the time India was facing COVID and Maharashtra was epicenter for COVID and children and women were the most affected. Already we were working, but nutrition alone cannot achieve the agenda. The biggest example was looking at early childhood development. When we talk of early childhood development, it talks about how mothers are nurtured to give the best possible start for their children. So it is not only nutrition, but it also brings in the sectors of health. Why? Because we are talking about how do you bring beautiful maternal care, and health plays a very important role in providing quality and timely care for children as well as for mothers. We joined hands. Why did we join hands? Because that was the time mothers and children were deprived of any services because of COVID. COVID also taught us that it's not one unilateral section, but everybody coming together. This was our journey. We had a very beautiful programming. We call it early childhood development, or it is called in Indian context Aram, which means early moments matter. So when we talk about a child, it's a newborn, but a newborn cannot just be living with only looking at nutrition, but that newborn also needs proper nurturing care. The principles that we used as the nurturing care looked at health, looked at nutrition, looked at water sanitation, safety, security, all this contributing to early learning. So when we initiated this whole journey, we piloted in two districts. So when we work together, we have to really develop a comprehensive plan. And we know nutrition can only achieve so much. But if you have to really talk about protecting child, you need to really bring in the whole issue of family-based care. And family-based care is an integrated approach. Through families, we really looked at community empowerment, because ultimately it's the community that really sustains the initiative. And this we were able to demonstrate in two districts. And these two districts, when I say it's is vulnerable, because this has large population coming from scheduled castes, scheduled tribes. So the whole agenda of equity, and equity cannot be achieved unilaterally. It is multisectoral response that contributes to reaching out to vulnerable population. We looked at the whole thing and we realized that we cannot really, these children, if they're growing well, do they really have the opportunity to get the best possible start? So how did we do that? So we pitched the whole thing on making health and nutrition aspirational to women and children in Maharashtra. So the entire program is pitched on aspiration, and aspiration is not through one sector. So each sector contributes. We also looked at the whole issue of what is it the best way the families and communities understand that even you can aspire, and what can you do differently. We looked at a community platform called the Parenting Fair, which is very unique to Maharashtra, where we bring the entire community together. So in a community, you have people who deliver health services, deliver water sanitation services, education, child protection. So we brought in the entire gamut of community together with all the teams working in the community to show what they can do in order to demonstrate and show that early moments matter can be implemented at scale. And this, the implementation taught us lessons. What can we do? And the transformation started happening because they could see what they're doing. And that was believing. And we today see a lot of initiatives coming from these frontline teams who's taking up this initiative and going further. And this resulted in a very strong advocacy with key policymakers. We know we have limited resources, but something that has happened with complete community response, with key sectors coming together, how can you sustain them? That's where we had this whole thing presented. And mind you, it was not just presented by UNICEF, it was the people, the frontline teams, the policy makers who are implementing in the district presented it to the highest policy maker, which was backed with a strong evidence, resulting in government endorsing it as the state flagship program and getting resources from the government to take it forward at scale. So this resulted in a co-financing model. And this is because of a strong integrated approach that we used till today we continue. Any section can be entry point. If it's a nutrition as an entry point, you bring other sectors, because the best possible start leads to best possible learning. So we also put this whole narrative, building brains, building future. And building future is giving the right possible start also for education, early learning. So where do the children go to study? These early learning centers, which is very unique to India and Maharashtra, becomes the best place. So the my colleagues who were working in water sanitation looked at how do you make this center joyful and in a place where children love to come and to learn. So this design was done through my colleague. So we all worked at different stages together to make this a complete initiative. And that is what is our great takeaway and great lessons. And this has resulted not limiting this only to Maharashtra, because it's possible, it's happening through systems, communities are responding, and families are seeing the change, resulted in Government of India taking it up. It's now gone beyond India, it's gone to Sri Lanka. Many countries are approaching us because it's doable and it is built on aspirations of families and communities.
Thank you so much, Raji, for those insights from Maharashtra. So I think, I mean, congratulations. So much has been achieved through this program, and it's really, really wonderful to have been part of the partnership together. I think for me, it's clear from this program and from a number of other programs, the Power of Nutrition has similar multisectoral partnerships with, for example, in Cote d'Ivoire, with the government of Cote d'Ivoire and the World Bank, where we're seeing that it's not just important to have those multisectoral integrated approaches at the community level, as you described, but to have integrated service delivery, integration at the local government level, all the way up to national government level. So for me, from your examples in Maharashtra, I think it's clear, isn't it, that you have to have that integration all the way from that household level, for that entry point to services for caregivers and children, all the way through to government level. And it's wonderful to see the example of government really taking ownership, investing the domestic resources into sustaining that. And systems as well. You talked about the system strengthening. I think I once remember you saying, Raji, that you're not creating villages of excellence, or islands of excellence, rather. You're creating an example, and then government are leveraging that through their own systems to take it to scale. So I think that's really such a fantastic element of this partnership, that it's through the government systems and it's showing that innovation and that it is possible. And then the government are taking ownership and taking that forward through their investment, which is just fantastic. Because that's how we'll make these things sustainable, right? For it to be government-led, government-owned. And another thing that really strikes me about this example is how that community ownership. It's wonderful to hear about those the parenting activities at the community level, because that's how you really deliver that behavior change, right? That's how the culture change and the behavior change happens, and that again is how something becomes sustainable. It's really through those caregivers taking ownership and changing their behaviors. And Raji, tell me, it's not just the mothers, right? It's not just, we have fathers, we have grandparents. Tell us about this whole community engagement.
Very interestingly, when we started this whole journey, many of our people from the service delivery, that is from the government system, who've been there for last 15, 20 years, saw a meaning in this whole approach, because you were talking about the whole issue of childhood development, and you're talking of early moments matter, which is focusing on the first 1,000 days. What does it mean? So when they started unpacking and doing, because what we did them to them was to really help them to understand the why. And second thing, we all talk of the science that, with proper nurturing and its stimulation, the brain gets wired. When the brain gets wired, you really have a child who's stimulated and a child who learns very well. What do you need for that? Do you need money? No. All you need is talking while you are breastfeeding, hugging the baby, and these little things which needs little time. That's what we've been. So we took this narrative to our frontline teams and say, is it possible for us to do that? And they were in every system, there are people who are very smart who's willing to pick on new ideas. So they went back and they went back to the community. They said, let us try. We said, okay, fine. And when they saw that the response was so good, in the sense they call it the parenting fair, but in Hindi it is called Palak Melawa. Palak means parents. The best part when they started explaining, and it's a beautiful fair which they see, like the whole narrative is shown right from birth, how the baby grows, and the entire community comes. So in the first two sessions it was only women. Later on they saw the men were coming, fathers, grandfathers, and we started seeing in many of the places fathers are participating. And if they come and they want to ask, because these are young fathers who have aspiration, so they want to know. And when they saw that how the brain development happens with these things, they really felt that we didn't know that. And we talk of science. What we did here was unpacking the science into a way it's understood by the community. For example, you say brain wiring and all is good for us. What does it mean for a mother and family? So we developed a game. And this is again, the credit goes to a very strong partnership we have. That is the medical school of Maharashtra, Sevagram, which was started by Mahatma Gandhi. Very good team. They unpacked it. And when we play this game of brain wiring, they see that better the interaction, better the nurturing, better is the brain wiring, which helps the child to really do well and grow well. And I think that was the turning point. And that was the game changer to really trigger participation of fathers and caregivers. There's enough information showing quality of time father has spent with the child was much more than what mothers could spend, because they are convinced. And today, in many places, anytime you go to Maharashtra, you don't have to go through UNICEF, just go there. you will find districts initiating this parenting fair because it is making changes in the community. Communities are owning. And you see, the best way is fathers participating in a big way, fathers, grandfathers. And some simple example I'll say, if the mother is pregnant, now the parents will say, father and the grandfather will say, you don't go, you stay back home. We'll go and work in the field. So let all this anecdotal evidences are there, but what we are saying is transformation is happening in the families. And we talk of system strengthening. System strengthening never happens externally. People within the system starts accepting and starts innovating and taking it forward, and that's what is happening today in Maharashtra when we talk about early childhood development.
Wonderful to hear. Thank you so much, Raji. And as we heard, at that community level, having the whole family, the whole community approach, leveraging early childhood development and nutrition, it develops the child's physical development is there, the cognitive development, as you said, the brain networks are there, the social and communication skills are there. So early childhood development and nutrition, hand in hand, really gives the child the best start in life for, as we can see, learning outcomes are improved and future productivity and life earnings are improved. And of course, this is an easy sell for any government, right? To invest in the human capital, to invest in your population, invest in your children through their nutrition, through their early childhood development, through all of these multisectoral and integrated models. Then you get the best learning outcomes, the greatest productivity in adulthood to bring up whole economies and whole countries for their own sustainable development. So that human capital story is really powerful, and I can see that the government were really convinced by this, weren't they, Raji? So the government are really investing and taking this forward, not just in Maharashtra and beyond. Isn't that right? So can you tell us how did you manage to get that government buy-in? How did this happen organically across that multisectoral approach?
I think first and foremost, when we started the journey and we started working with our systems, because we believe very strongly that government systems gives you the scale, and scale gives you the impact. So we were very clear we'll not do any islands of excellence, because then it just dies out when the funding goes. So here we wanted to demonstrate, and we work through our system. We work through our entire health system, nutrition system, no matter what are gaps. They may not be the best and all, but we need to believe in them and help them, join hands with them and tell them that whatever you have done is you have achieved. We only played a role of, encouraging you. So when we did this in two districts, we got enough lessons of why it was working and who were the people who were the lead. So we identified them, many of them, and they were all from the system because they believed, and we created them as champions of change. These were champions from the system who we identified, and when they started taking it up, we ensured these people are recognized by highest policymakers, because when a highest policymaker appreciates and sends an appreciation letter, wow, you've done well, that really motivates her to run further. Okay, somebody has acknowledged me, I'm known that way. So that was one of the trigger for us to really look at taking this whole agenda forward. And what we have seen today is in Maharashtra, the voices of advocacy didn't come only from UNICEF. The voices of advocacy were people who were actually implementing in the districts. So we call it the implementation science. There were key policymakers who were young, who had small children, and when they saw that people who are reporting to them are doing such wonderful job in the field, these policy makers went to say, can you come and also train our wives? These are bureaucrats, policy makers, telling my frontline functionaries, come and train my wife and my mother to say how the children have to be taken care of. Now these things were something which was presented to our highest policy maker who heads the department. She's a very senior bureaucrat, and they presented it. And she first heard them out. What is that new you're doing? You've been doing this program for so many years. Why you say you're doing? And the examples that was given, even we could not. I'm sure we would not be able to give. That was the level of commitment and conviction, because they saw the change and they believed in it, and they said this is the answer. And the narrative shifted. That if for everyone, stunting, wasting is okay for us, but for a mother, stunting, wasting is nothing. So the narrative shifted from how many children are stunted and wasting to how are your children doing. And that really changed. And this is the example given by some of the frontline functionaries who will never dare to talk in front of a very senior policymaker. And they said, "Man, this is what we are seeing." We don't go and ask. We say, "How are your children doing?" The moment you have this conversation with the parents, the whole conversation shifts. And then they are willing to talk. Why, wow, and all. And that's how they have evolved the program since last 3 years. And that's where we are. And this has resulted in very strong endorsement by the government, because it came from their people. Yes, we are there, we backed it, we adapted it, we contextualized, but the voices came from them. So it's a joint thing that resulted, and they said this is the answer. And simple, like you go to any center, you say, "Okay, you did all that, what is it?" And they very proudly say, "In my center there's not a single child who's malnourished." It's a big thing. That has been the force behind the entire advocacy. Today, government endorsing. There is a very clear guideline. It's become a state flagship program with resources, continues to be funded and given for the state scale up. And now they're on 8th of March, and I wanted to really tell you all, there was a launch of ECD, the first 1,000 days for urban, by none other than the Chief Minister of Maharashtra. So this is the level of advocacy.
It's absolutely fantastic to hear. So it's very, very clear, Raji, that some of the learnings from the program has been, as you said, to really have that buy-in and full integration and involvement of government at all levels from the beginning. So that ownership is there, that joint ownership is there. And then mobilizing the voices from within government at different levels to advocate from within, saying, we've seen it with our own eyes. We know this works. We're so proud of our achievements in our locality. And can we amplify this across the country? So that's really, really valuable learning, and something I think we can take forward in so many different areas. So I think on that note of learning, Raji, we've seen great success in replicating the model across Maharashtra, across other states in India, even discussions going on around replicating in Sri Lanka and other places. What would be your learnings or your recommendations to other partners who might be watching this thinking, how do we deliver something multisectoral that goes from the community all the way to scale like this? What would be some of your recommendations or your advice or your key learnings?
Uh, it's very important first to understand what is working well. We always go with an approach of what is not working. And that's where the whole people want to take what is working well and why is it working. And then you start pitching on it. And then we always believed in that, how do you nurture your team? A team is not just UNICEF, team is the entire team who is working. And any program can be an entry point. For example, if it's a child protection, protection is one of the core of, protective security, and protection is one of the guiding principles for nurturing care. How do you use child protection to really bring in the ECD lens? How do you, if somebody is doing on health, I'm talking of newborn care, what happens to babies who are severely underweight, severely low birth weight, and they are being discharged? How do you really talk about the nurturing care? So this lens of nurturing care can be applied any program. So if health is initiated, we integrated with health, because you cannot have a baby growing to his full potential if you don't talk of breastfeeding, if you don't talk about complementary foods and feeding, if you don't talk about responsive feeding. It's not just feeding, it's responsive feeding and all. So that's how we have really built it. And integration is the answer when your resources are limited, and if you want to have good impact, and if you want to scale, it's non-negotiable. And we really can do. You may not see the answer today, Charlotte. It may take time, because any institutionalization of an integrated approach takes minimum 3 to 4 years, because people have to join you to, first they have to believe you, and then they come. So people with common ideology will come first, others will watch you, and when they see these two are working, the third person finds there is a scope. Okay, let's work together. And that's how in Maharashtra we've been all working together. And if we have been able to show the result, it's completely intersectoral. And even many of the sectors with whom I work, they use their resources also. And I piggyback on them to say, can we take it forward? So that's how the whole integration has got evolved over the period of time. But that's the answer, Charlotte. There's no way that one single sector can make an impact. It's not possible.
Absolutely. I couldn't agree more, Raji. It's if we are to address all of these multisectoral drivers of malnutrition, we have to work across sectors, right? We have to come together as partners. And I think what you just said about efficiencies, cost efficiencies, we if we work in silos and we all do our different thing, we have duplication, we have multiplied resources. If we come together, we can be more efficient and have a greater impact together than we can apart. But I think one of the things you just said, Raji, is also really important to remember. It takes time and patience, and you have to bring people along with you on the journey, right? And it won't happen overnight. Exactly as you said, it takes years, but it's worth it because once you get there, you've built something sustainable. You've built something that's owned at the community level, all the way through to government level. So it's worth the wait, right?
Absolutely.
um, so I think on that note, we could continue talking for a very long time about such a fantastic program with so many learnings. But I think for me, it's really, really clear. Investing in nutrition is a huge return on investment. Recent World Bank figures show for every dollar invested in nutrition, there's $23 of return on that investment in terms of social impact. And we've seen that how do we deliver for nutrition? Well, a multisectoral approach to maximize the expertise, the networks, the systems, the partnerships across all these different sectors to respond to all the holistic needs of the child and the family and the community, all the way up to national level. So I'd like to close with Raji asking you what would be your call to action to the sector, or anyone who's listening, anyone who's watching today, what would be your call to action to motivate them to keep going?
I think issue is very important, and we are working for those children and women who come from areas where they don't have access, and you make transformation there, impact is huge. And I think it gives a meaning to the work you are doing. So it's absolutely non-negotiable. And for me, for all of us, the energy comes from working for such people, children and women. So that's what is my message to all the key stakeholders and all. And it is possible, and it's happening.
Wonderful. Thank you so much, Raji. And I would echo every word of that, that together, if we form strong partnerships, we keep investing, we make the most cost-effective investments, we work together, we form partnerships, and it is all for the children, women, adolescents, communities. It's all for that future and empowering them to have that bright future that all of those children deserve. So thank you so much, Raji, for joining us for this conversation today. Thank you everyone for watching. We hope you found the conversations interesting and enlightening. Thank you very much.
Thank you. Thank you, everyone. Thank you so much.